la civiltà dell'amore. Fratelli e sorelle, costruite senza stancarvi mai questa civiltà. Lavorate per questo, pregate per questo, soffrite per questo.
Buonasera a tutti.
Good evening, everybody. This is the third edition of Talk. This year's title, The Possible Change. It is a space for in-depth analysis wanted by the Fondazione per la Sussidiarietà. Good afternoon to Mrs. Irene Elisei. Good afternoon and welcome to you all. Welcome to all the audience and the people connected in streaming. Unlike the two previous editions, this talk edition is being held with the public, with the audience in presence, in addition to being streaming and available on the website of La Repubblica and Sky TG24. We're going to talk about healthcare beyond the COVID. This is just one of the topics we will deal with over the next 6 days. We will touch upon fundamental issues for the future of our country linked to the 6 missions of the National Recovery and Resilience Plan. We will try and have a look at the various topics, and with the help of the guests here with us and in connection, we will start with the healthcare system. We will recap what will happen over the next few topics and few editions. Tomorrow we'll deal with infrastructure, then research and university, and then innovation and digitalization, then work and inclusion, jobs and inclusion, and we will conclude this pathway by looking at Europe and the future of Europe. We wanted to focus on these topics by starting from a question. We asked ourselves a question: where are we heading to? Where is the effort we've been making at European level leading us to, bearing in mind the pandemic and the ongoing war? Italy has received, nonetheless, an enormous amount of funds from the European Union. So this introduction is due. We will start to talk about healthcare system because the last 2.5 years of pandemic have changed our way of living. The guests are Minister Roberto Speranza, the health minister of the Italian government. The hope, his name means hope, so the hope is that we will have an improved situation. Well, it already happened during a TG1 TV news edition. Mr. Giorgio Vittadini, the head of the president of the Foundation for Subsidiarity. Mr. Giuliano Rizzardini, the director of the Department of Infectious Diseases at the Sacco hospital in Milan, one of the hospitals at the forefront of the fight against COVID. And we have in connection Mr. Nino Cartabellotta, Dr. Nino Cartabellotta, the president of the Gimbe Foundation. Good afternoon, everybody. The foundation monitors the healthcare system in Italy. It was created in 2010. It is an ONG, a non-lucrative foundation. Minister Speranza, the first question for you. What is the situation after 2 years of pandemic? What would you save of all the things you've done, and what would you not repeat? The first message I would like to convey in thanking you for having me here. So I've already been a guest of the meeting in 2019, in August 2019, a few weeks before I was appointed the Minister of Health, and we were talking about healthcare. And today we are in the final stage of my experience as Minister of Health, and I'm glad to be here to talk about healthcare, which is the most important thing that we have in Italy. The first message I want to convey is clear. Going beyond COVID, yes, we are going beyond COVID because we are stronger now. We have a strength we didn't have earlier. The antiviral drugs, the vaccination campaign enabled us to tackle the situation, but we should not think for a moment that COVID-19 has simply disappeared, because unfortunately this is not the case. So I stubbornly continue. We are at the beginning of an electoral campaign. I will continue to see that we need to be cautious. We need to be with our feet on the ground, because we saw the last 3 years that the COVID-19 is insidious, and we must never think that we have won the battle. Then the COVID-19 and this difficult situation taught us some things, and we should cherish all the things we've learned. I always remember what Pope Francis said in the deserted, empty square, Piazza San Pietro, one of the strongest images at the beginning of the COVID-19 pandemic. Pope Francis was alone, and he said, the worst of this crisis is the risk of wasting it. So wasting the crisis is worse than experiencing the crisis. We should make bold choices. First of all, allocate more resources to the healthcare system of this country. We should carry out a cultural battle. Every euro that is spent on healthcare is not simply a public spending. It is the greatest investment on the quality of life of people. If I look to the past situation, to answer the question, in our country, for too long, too few resources were allocated for healthcare. We have reversed this trend, and I will give you some figures. Figures are stronger than words. Over the last 10 years, on average, 1 billion more every year was spent on the healthcare system. When I was appointed health minister, 114 billion euros were spent for the healthcare system in Italy. The amount of money being spent by the state on the healthcare of our country. 1 billion euros more was spent every year. That was the average. Today, after 3 years of pandemic, we have reached 124 billion euros. We've increased this amount by 3.3 billion euros more every year. This is a great leap forward. If you have a look at the curve, you will see that the curve has increased a lot over the last 3 years. This is not enough. I think we should do more, being aware of the fact that the COVID is teaching us something. To be brief and to give you a short answer, we should understand that we cannot make savings when it comes to healthcare. And I repeated this concept many times. The quantity of the right to health that could be safeguarded depended on the Excel spreadsheets of the departments dealing with the budget. It is a quantity of the right to health you need to safeguard, which decides and which determines the figures on the Excel spreadsheet. And so we can introduce a topic which is related with what you said, a keyword, the community houses, which are different from the health houses, as the minister was explaining to us. And these are different from what has been existing for 10 years in Emilia-Romagna region. It has been also created, it's a system which has been created in Lombardy as well, and it is a novelty which is one of the key elements of the consequences of the pandemic. We were talking about 190 billion euros being allocated. 15 billion euros will be allocated for modernizing the healthcare system. Where is this money going to be spent? I don't know whether some of you already had experiences with these community-based houses, and we're going to have one of the first contributions of this day, and we are going to show you some reports. Let's have a look at the first journalist report. You see on the signs hospital, but the real name is House of Health. We are in Castelfranco Emilia, in the heart of a region which bet 12 years ago on these territorial structures, territorial facilities. We have about 100 of these facilities in the Emilia-Romagna region, linking the territory with the healthcare. Here you can find several types of practices, nursing care, catering for disabilities. You find services such as pediatricians, and 5 general practitioners also guarantee healthcare 5 days out of 7. I worked alone as a general practitioner until 2009, and I would not go back to that kind of work. We need to work as a team, and this multiplies the possibilities for the patients to have access to first-level services, and it improves the work of professionals, because working in a team every day can increase in the best way possible one person's knowledge. There's a contamination of ideas. Here you also find a hospice with 15 beds and a community hospital with 20 beds for patients being sent away from the hospital. And resources are extremely important. Territorial services are not cheap. In order to create a territorial quality network with the houses for the community, hospices, a network for whole household care, house care, etc., we need significant investments. And I believe that this is going to be the way to move forward in order to get out of the old way of managing the healthcare system. I believe that this problem should be tackled. Not only public and private entities, involving all the other entities in the territory, including the third sector. This is what the Lombardy region is about to carry out. In Lombardy, if you have a look at the valleys of the Bergamo province, you can understand this very well. One of the most well-known experience is the experience of the COVID hotels. In those cases, the managers of the COVID hotels who organized this kind of facilities, where they shared working tools, which we are currently using in all the access points for the community clinics. We try not to disperse the experiences in the field with the aim to pool all the efforts possible. In every municipality, we have 9-10 subjects dealing with welfare in some way or another. Social services, volunteering associations, nursing homes, practices, outpatients clinics. The gamble is that of having 9-10 operators working as a network, so integrating all these services. Today, with the community houses, well, we have an opportunity we absolutely need to grasp. So let's involve the president, Mr. Nino Cartabellotta. There was a certain degree of interest in the whole, because the community houses are a novelty. Is it a recipe that can perform well? It means investing resources from a structural point of view, and also on the staff members, nurses and physicians. It can work for sure, and it will lead us to go out from the healthcare based on the hospitals. For each problem, a patient had only one point of reference, namely the hospital. Reorganizing the territory wanted by Minister Speranza with the Ministerial Decree number 77 is one of the reforms contained in the National Resilience and Recovery Plan, and it includes the telemedicine, it includes the community houses. We need to have a paradigm shift. We cannot think that quality care is provided only in hospitals. We need to have facilities working all together as a network, as the previous colleague said in Modena. In a hospital, you are more accustomed to working in an equipe, in a team. We now need to challenge all the resources at structural, organization and personal level. We must not duplicate services because it would lead to a waste of money, of public money. And we should also disinvest hospitals when it is possible to provide health care to patients at home, for instance. Hopefully this can happen as soon as possible. Although we are currently experiencing an electoral campaign, so we hope that we can have Minister Speranza appointed as a health minister again. Mr. Vittadini, in your experience, is it possible to have a bottom-up approach when it comes to health care? What are the possible risks when it comes to wasting public investment? The idea that health care is no longer an individual element. It is a collective issue. If I do not take care of my health, I can lead other people to get sick. So we need community houses, we need public and private entities, we need regions, regional authorities, we need the state authorities. We need to collaborate. If a person works on his own, the results will never come. If you simply allocate money without listening to the desires and the necessities of others, you run the risk of wasting money. We can no longer have a situation in which we have a state on the one hand and individuals on the other hand. We need to have a collaboration between public and private entities in order not to squander money. So we need to clarify one aspect: healthcare and community houses. We have an ambivalence. Well, I am glad to explain it in about 1 minute because it is important. What is the difference between health house and community house? A health house was, and it existed only in just a few regions, unfortunately, I may say, it was based on health care. The community house needs to be something more. It should be a place where a person is catered for from a social perspective. In Italy, when it comes to the administration, we have always divided the health-related aspects and the social-related aspects. We have a health ministry and a minister in charge of welfare. But my opinion is that we are carrying out this kind of reform because you can divide the healthcare-based system and the social-based system. But when it comes to a person and the life of a person, these two aspects go together hand in hand. When you have a social problem, you will almost certainly have a healthcare issue. If you have a healthcare issue, if you analyze a situation, you will also have a social issue. So the community house should focus on solving social and healthcare related problems with a key word, which is proximity. Antonio is the president of the Italian Federation of Pediatricians, the key association of pediatricians in Italy. The community house should be a place where people are catered for at the social level and at the level of healthcare. Dr. Rizzardini, well, your colleague from Bergamo, during the interview we saw what he said. If we didn't have hospitals, we wouldn't have been able to provide an answer to the COVID pandemic. So is the role of the hospital a central role? According to your experience, well, according to our experience, well, the hospital had a virtue and a defect. It was able to provide an answer to an emergency. Hospitals provided an answer to something nobody knew up until just 2.5 years ago. We didn't know how to respond, and the hospitals became full of people in need, and in some cases there were also incubators for the transmission of the disease. But I must say that the response was outstanding. considering that we didn't know anything about the COVID-19. I would like to describe you our experience. The Spallanzani and Sacco hospitals were are the reference hospitals for infectious disease emergencies. So we were alerted to be ready for the emergency. We reviewed all the protocols, especially those for the SARS dating back to 2002, 2003. On the evening of the 20th of February, we were called and informed that there was the first positivity case in Codogno. We all know everything about this patient, the first patient. So the idea was that of getting this patient to come to the hospital in total isolation. So at 8 p.m., 3 specialists of infectious diseases and 2 resuscitators went to Codogno, to the hospital of Codogno, and the first physician came out saying that we could not move this patient, otherwise he would have died during transportation. So a resuscitator would remain there. In the meantime, we received another patient, a young patient with a serious respiratory, with a severe respiratory insufficiency. So we took away these patients, their wives, and after 10 days, the 80 beds of the Sacco hospitals were all full of patients, and we needed to expand the hospital and the number of beds, and we did not expect such a situation. Had we had a territory able to absorb those patients, it would have helped. But at that moment, we did not even know how to treat that disease, because we did not receive enough information from the Chinese authorities. What Minister Speranza said is very important, the integration between the social aspects and the healthcare aspects. After 2 years, we are now living in a situation in which we have a different disease. We had 80 people in the hospital with a positive swab for COVID. The average age was 87.5 years. So the disease is totally different now. All of these patients, half of them today, could be managed at home in a different way without having them forced to be in an acute department ward of a hospital. So they can be managed in a different way. And so I would like to introduce a second topic we would like to focus on today, the importance and the role of physicians. I'm not referring to the physicians working in the hospitals dealing with the most severe cases. I'm talking about general practitioners and GPs, and we are now going to have some interviews we recorded in several parts of Italy, from north to south. Some of those interviewed complained about the general practitioners. Let's have a look at their interviews.
We lived a very frustrating situation because we didn't know how to face that. 370 doctors who died, more than 100 general practitioners died. And this shows the situation. It's an overview about our healthcare system, which was not ready to face this situation. I remember once I went to an apartment to visit, to make 7 visits from the 3rd floor to the 2nd floor to the 1st floor, one after the other. And finally, we had to manage all the situation at home. Less than 10% of the cases, the COVID cases, were actually hospitalized. So more than 90% were managed by general practitioners. So out of this submerged part of the iceberg, there's nothing which has been done. And general practitioners received hundreds of inquiries and inputs from the local health authorities, having to deal with a huge amount of documents and bureaucracies, while from a scientific and medical point of view, how it should be diagnosed and treated, this was the key point. We had to deal with something completely unknown. This experience taught me that the right to health is for everybody, and health shall be for everybody. Well, this crisis has been an opportunity to look for colleagues, to look for feedback, creating a network and working with a professional category which is featured by some issues, which is usually working too alone. So it's the time to stop working alone, getting out of this lonely approach, aiming at working together and considering our work, our job as a network. In my opinion, in the future, we need to focus on health houses or community houses where the patient gets in and he or she can find whatever they need. Well, the idea of having a core point where you can meet with other specialized people doing something positive is very important. I don't think this can work with the bureaucratic approach, saying that the GP will have to work a certain amount of hours in his office and a certain amount of hours in the community house. This won't work. It's fundamental to move on and focus on the specialization schools, considering that there is a training path for general practitioners, which is less paid than specialization schools. When they come to us for the internship for the 5th and last year of the medicine university, they are amazed, and this is due to the cultural background that there is in our country. Always talking about doctors working very hard, while GPs are considered not to work very hard, which is not true. Well, there is this idea that the GP is not working a lot and earning a lot of money. But if let's consider that if I write like that on my document, and this is to be paid for the secretary, and then taxes and office management, and the last half has to be invested for all expenses. Well, I actually earn like hospital doctors, and then we are only paid for 12 months and not for 14 months. We don't have paid holidays. For women, there is no maternity leave, and so on and so forth. There is no specialization course for for general practitioners, as it is for all the European countries, and this does not actually create a positive image for this job. Well, the job of specialized hospital doctors has always been conceived and considered as a more specialized job. And it's always been more kind of protected, and there's always been this aspect. What I realized as as being something new, which never happened before, is that more experienced and aged doctors are step by step starting retiring, and this never happened before. This was the answer that we had from general practitioners. So Minister Speranza, of course, this is not a comprehensive survey, but this states also what also other doctors can think. So there are few young people now looking forward for becoming general practitioner, because there are many challenges to be faced. For example, a lot of bureaucracy, very long time framework. So how to review the role of the general practitioner? Let me say that the general practitioner plays an essential role within our national healthcare system. The last speech that the Prime Minister Draghi held in the Parliament, I was sitting close to him, and I noticed what he said, and he announced a reform that was almost ready to be implemented just in a few weeks. And in my opinion, this would have provided even more value to this role. There are more than 40,000 general practitioners in our country, and this was aimed at focusing on the work of the general practitioner and the rest of the national healthcare system, which usually has a gap. So there is a gap between these two realities. So the reform would have been implemented trying to fill this gap, working with the trade unions, with the regions, and I really wish that the next government will keep on working and focusing on this very important reform. Another very important element, which is very significant in my opinion, we had an issue with scholarships. And today we are talking about the University of Medicine, and the issue for our country nowadays, well, at least until a few months ago, because actually this issue has been solved at present, was that we used to have so many young people, or even not young people, which graduated in medicine, but that didn't get a specialization scholarship. What is it about? Well, in Italy, in order to be allowed to work in the national healthcare system, it's not enough to be graduated, but you need to be specialized. When I became a minister, they told me that, well, young graduated people, students, told me that there was this issue which was about young, or even not even young people that graduated in medicine, but who didn't get this scholarship, so they were not allowed to work within the national healthcare system. There were an average of 5,000-6,000 scholarships in the past, while last year we allocated 17,400 scholarships, so 3 times than 2 years ago. So in 2 years we allocated 30,000 scholarships. So this issue has been solved, and this was a real waste of skills, because an individual who graduates in medicine, this requires huge efforts, of course, and a huge effort for the individual, of course, but also for the family of those students, because paying for your son or for your daughter attending the University of Medicine is very challenging, but also for the state. This is an investment in professors, classrooms, universities. So we had this amount of people who graduated in medicine, but who were not allowed to work within the national healthcare system. Today, this issue has been solved, and I think that there are many young people who would like to play this role and have this job, because I think we need to recognize the real dignity of this work, of this job, and I think we shall all commit for this, aiming at this goal, despite the political ideologies. Talking about the limited access to universities, regions asked to remove the limited access to the University of Medicine. So now we just heard to the Minister of Speranza. What do you think about that? I believe that apart from the electoral slogans that, of course, are very present in this period, also talking about the healthcare management and the pandemic management, we need to be honest. We had to deal with the lack of resources because of an issue of wrong programs and planning, because for many years we actually worked without guaranteeing the scholarships to the graduated students that we had in our country. I remember what happened during the 70s when basically we opened the doors to everybody, and in Italy we started having a huge amount of people graduating, creating that famous phenomenon of many people graduating, and we have never been able to tackle with this issue. So the problem nowadays is to be able to rebalance the policies in terms of the healthcare system, considering the issue of the contracts with the operators within the healthcare system and the renewal of their contracts, the reduction of workers, the maximum amount of money to be allocated for this sector, which was established in 2004. So basically, today we have a huge amount of money to be invested for the infrastructure, but not the same amount of money to be allocated for the human resources. So it's clear that we need to focus on finding the right people to be placed in the right position, and we shouldn't risk to consider this huge reform, which was actually implemented by the government based on the Ministerial Decree 77, aiming at developing that furthermore and focusing on the general practitioners as well. This kind of convention could be considered just as a convention, but it should be applied to the entire system, focusing on 60 million people in our country. So that's the way we shall have this approach. So in terms of financing funds and investments, well, your journal was focused on the health care, and here we can see the cover, the first page of the Nuova Atlanti journal from the foundation. So let's see the first video focused and recorded in a hospital, and let's now see what changed and what we learned already during the pandemic, the pandemic period, in a hospital in Brescia, in the city of Brescia. We are in the northern area of Brescia, which was one of the most affected areas from the pandemic, where the hospital has been deeply changed, where more than 5,000 people are working and more than 50,000 hospitalizations per year. Well, the pandemic had a huge impact on our structure, and we had to review the daily work of everybody. Everybody had to review the way we used to deal with this unknown situation, and this happened overcoming what we were used to do before, reviewing our care system. It's been very important for us to be able to quickly review the entire pavilion, 5 floors of pavilion. We call that Scala 4.0. Basically, this was the name of the staircase 4.0, replicating the example of the Industry 4.0. So it's a completely technological pavilion with a specific area dedicated to COVID, with a multidisciplinary approach and a lot of specialized people working together as a network. What did we learn from this experience? Well, first of all, I believe that we learned how to face the reality and learning from the reality, basically overcoming that approach to get back to so-called normal standard situation. But in our job, we always have to deal with unexpected events. Ospedali Civili were created 600 years ago, and they've kind of been recreated, completely recreated after the COVID pandemic, overcoming the limits of a building built during the 60s. Well, the best solution was to rethink a new hospital, growing in the northern area and increasing the hospital area and building a huge hospital for the most severe cases, and creating within the walls of this hospital a new area, thus specializing the older part of the hospital with functions which are useful for the to achieve the goal of the entire structure. So the project is basically relying on a hospital structure able to review itself and to renew itself. So basically, the goal was to create and build an hospital within the hospital, completely focused on the patient, during his most severe part of the disease, and involving the entire network and also the other parts of the hospital. And we imagine that the entire complex will rely also on the health houses or the community houses, relying on the network which is already present on the territory. This is a work accounting for 500 million euros, and this is one of the most important projects that the region Lombardy sent to the government in Rome for the resilience and recovery plan. Also within the healthcare system, which is a very delicate field, what do you think that we shall consider from this experience? Well, let's start from what we heard so far. It's clear that dialogue and the human being are at the core of the healthcare. And without those aspects, there's no reform which will succeed. So public and private sector will work only if within the community, the health community, they aim at a common shared goal. So it's good to have a private sector and to have a public sector aiming at this goal. So the key point is to put at the core of the healthcare system the human being, the person, with a real dialogue. That is the same between region and state. If they're not having a real dialogue, they will never succeed. So the goal is to put the person, a community of people, at the core. Otherwise, there won't be any reform succeeding. So in conclusion of this second question of the roundtable, the question is can we still talk about pandemic? Well, the OMS still didn't closed this stage, this process. So actually, the virus has been changing a lot, and we are dealing with different strains now of the virus. We need to be careful, as the ministers said at the beginning. So in the future, we need to be good in playing in advance and moving far in advance before the virus develops. So we need to look for new strategies. Of course, the virus and the disease today is no longer what we had to deal with 2 years ago. So we need now to sit around the same table and understand what we shall do for our people. The idea is to move within the territory, and this may be a winning approach, but I think the first steps should be that we shouldn't have only containers in the territory, but we need to have contents as well. As Giorgio was saying, and those contents are people. So this is the main investment we shall have, and for the future. And politicians shall help us for sure. We need to collaborate with them, and I think that that's what we have been doing over the last 2 years and a half. There are the most fragile people, so elderly people or people affected by other diseases. So they are the most fragile people, and we want to talk about them. And let's now have a look to some figures, some data that immediately explain what we are talking about. This is the table which has been developed. So this shows the percentage of the GDP which is invested for those categories. And as you can see, Italy lags behind compared with Germany, allocating 4.5% of their GDP. The European average is around 4%, and then Italy accounts for 2.5%. So, and I would like to share the interview with the President Lagnocchi now. And there are a lot of people that still have to deal with this situation in Italy, in our country. So the interview focuses on the situation at present.
It would be enough to give you an example referring to the number of elderly people currently not self-sufficient. About 3 million of these people in the so-called nursing homes are less than 300,000 people. About 90% of non-self-sufficient elderly people are forced to remain at their homes. So from this point of view, going beyond any ideological approach, we should imagine customized services for these people. There are people who need a highly professional care standard that can be offered within facilities in which you find social care as well as health care, a minimum level of relations between elderly people, the possibility to be fully satisfied and to have one's needs met. Other cases in which care can be provided at home. So these two systems should coexist. One of the objectives which Father Carlo left us is that of putting at the disposal of all these people the best innovations available when it comes to technical features. We have the possibility to start from the concrete care for these people. We have a chance to analyze and observe their coming from their health conditions, and then draft models or care protocols or instruments or imaging, new ways of providing care and treatments that can be proposed and offered to these people. I'm thinking about all the work that was carried out over the last few years when it comes to severe brain lesions. The Dognocchi Foundation is one of the most advanced facilities for treating patients who suffered severe neurological issues. One of the issues we need to tackle every day is that of a difficult or challenging availability on the part of the decision makers to provide answers, bearing in mind our role as Christian-based entities working according to a non-profit logics. We are asking the state to involve entities such as ours when it comes to designing, devising solutions. It is not a matter of talking about miracles. We focus on the intelligence of man to work servicing those who are in need, those who are suffering. So that was a question. Is there there's a possibility? Why shouldn't we create a relationship based on the work to design a service together? Well, I believe that it is the case already. Of course, the competence lies within the regional authorities. They need to indicate the trajectory. Our beacon is the Article 32 of the Italian Constitution. I believe it is the most important article of the Italian Constitution. Just a few words, but extremely luminous. The Republic safeguards health as a fundamental right of the individual, interest of the collectivity, and it guarantees safe, free care, health care to everybody, even poor people. There is no other part of the Constitution where fundamental rights appear together, one after the other. Only when it comes to health, the Constitution talks about this kind of right. During the debate, somebody wanted to use the word citizen, but in the end, they opted for the word individual. Individual means a human being. So the healthcare system in Italy is universally available. If a human being is sick in Italy, it doesn't matter where you were born, whether you are rich or poor, or the color of your skin, you have the right to be treated. And Italy does it with its own healthcare system. We have a public network, and we also have accredited private operators, but the state is the entity allocating the resources and catering for all these people. After 3 years as a minister, I would like to tell you that I compare my ideas with many countries of the world. There are many countries in the world where either you have a credit card or you have a life healthcare insurance, or you will not be treated if you have a condition, a medical condition. Of course, there are things that can be improved, but in Italy, whoever is ill is entitled to receive a medical treatment. And we need to carry this out with our own model, based on public entities and private entities, but we should safeguard this model as much as we can, because this means guaranteeing a fundamental right, which is the right to health. I believe this should be safeguarded and defended in every way possible. I would like to listen to Mr. Cartabellotta's opinion in this respect. On the one hand, you are critical, but on the other hand, you also defend the national healthcare system. Is there any room for increasing collaboration, such as those we saw in the report? Of course, provided that the rules are defined by the public sector. Over the last few years, I must say that several national institutes and the rules for accreditation can be implemented in a heterogeneous way, and this created services where there were no needs for healthcare, and vice versa. In some regions, the public sector was not sufficiently supported. The private sector has a very important role to play, but only when it makes up for the shortages of the public system. And differences exist between the regions in Italy. It is true that the Republic in Italy safeguards the health of the individual. But it is also true that today this Republic can be considered as a place where there is a conflict, and this conflict goes to the detriment of those citizens having a lower wage or those living in southern Italian regions. I believe that the National Resilience Plan is also a novelty. We have an entity which is a supranational entity, Europe, checking all the indicators, the milestones, and the targets every 6 months. Referring to the 21 regional healthcare services, I believe this is another organizational and political initiative so that we can increase the collaboration in the mere interest of the health for all the citizens or the individuals. And we should focus on the concept of the Republic as well. President Vittadini, healthcare and social and healthcare create proximity links. How important it is to create a subsidiarity culture? Well, in this case, I want to use another word, a new word, quality. In order to have a subsidiary approach, you need to guarantee quality. You must check that the private and the public sector does not waste money. So if you have subsidiarity, you have quality. In the end, if you need to cut or to invest, you will invest on those who are more able to guarantee services for the people. If you do not focus in this respect, if you do not focus on these aspects, you will favor speculations. So a quality system is of fundamental importance so that everything we mentioned can exist, either public or private. We need to focus on quality. So the private sector cannot do whatever it wants just because there is an agreement with the state. And in this way, you can overcome a political arbitrariness as well. So Professor Rizzardini, you worked in a hospital which was a sort of a point of reference over the last 2.5 years. Well, for sure. Certainly, this is the case. We are drawing to a close, and I would like to conclude by saying, by giving you a couple of images. In a few years, I will retire, and I will certainly remember a couple of things. I also worked in Africa, and I saw many things in Africa as well. The first image is the ability to work together. So observing a collaboration between administrative staff, physicians, nurses, all working together, providing a response to the emergency of the COVID, especially during the first months. And the second, this is a heritage which should not be forgotten. I talked about physicians, nurses, and administrative staff, which is not always mentioned. And then there's another thing I would like to stress, the word compassion. In the Latin sense of the meaning of the word, suffering with. Nurses, all the nurses suffered along with their patients. When all these patients suffering from COVID could not talk with their relatives, and the nurses in this case, they acted as if they were family members, and they provided information to the family members of informing the family members on the situation of many patients. Many patients reached the hospital and they got worse very, very rapidly, and they died without having any of their family members close to them. We should never forget these things. We were considered heroes in the first months, and then in the end we received reports on the part of patients, and this is not a beautiful thing. I would like to conclude with Mrs. Speranza, making reference to a note by the Education Ministry. This was sent to the directors of the schools. Starting from the 1st of September, even teachers and other staff members having not received any doses of the vaccine can go back to work. The only obligation which remains at present still exists only for all the staff members of the healthcare system, and I'm referring to healthcare professionals, healthcare workers. I believe that all the countries should be grateful to all the people working in the healthcare sector. But I would like to say something else. After 2.5 years fighting against the COVID-19 pandemic, we gradually moved from a set of obligations, to a different dynamics, recommendation referring to responsibility, to being responsible. If you don't have an obligation, this doesn't mean you have no responsibility vis-à-vis the others. 90% of people in Italy received 2 doses of vaccine. And so we can manage the situation in a different way, but not having an obligation does not mean, and I would like to stress this again, this does not mean that the virus has gone. We still have to be cautious. We should continue using the masks whenever this is the case. And we should also continue to go on with the vaccination. People aged over 60 are strongly recommended to receive the 4th dose, the 4th doses of vaccine. Hopefully, IFA can offer an updated version of the vaccine, but I need to be clear in this respect. The vaccines used up to now, when it comes to their ability to avoid serious disease, are extremely effective. This is their ultimate aim. What was the benefit of having a vaccine? The benefit was that we managed to manage a great number of cases. A few weeks ago, we had over 100,000 cases in one day in Italy, but over 90% of people already received 2 doses of the vaccine. This is the ultimate aim of the vaccine. And the current vaccines have a great ability to prevent serious conditions. So this is my appeal. I would like to urge all the people aged 60 and over 60, and all the people who have chronic medical conditions to continue to receive the 4th doses of the vaccine, because we should avoid severe cases. Well, I've just received the 4th doses. I had a COVID. I had a COVID. 3 doses, and then I had a COVID. So just a final remark. We are going to have elections in a month's time. We have the quarantine rule. If you have a COVID, you need to remain at home for 7 days. If you get the COVID, starting from the 20th of September, you cannot go to vote. These are the current rules. I think this is a matter of precaution. If you are positive to COVID-19, you should not go out. You should remain, you should stay at home for at least 7 days. I would not be so serene if I knew there are positive people walking and going out of the home. Tomorrow we're going to talk about infrastructure. So see you tomorrow. Bye-bye.
Civiltà dell'amore, fratelli e sorelle, costruite senza stancarvi mai questa civiltà. Lavorate per questo, pregate per questo, soffrite per questo.